We started care management about 3 years ago with a small pilot program and about 15 practices. It's really expanded over just the last year, actually. We're in 50 practices now, seeing patients with a team that's very diverse in their education and their experience. We have nurse practitioners and RNs that are specially trained in chronic care management. We have PharmDs that have postgraduate training in ambulatory pharmacy. We have social workers, of course, and also dietitians that are certified diabetic educators. We hope that we can really help our physicians deal with the sickest and toughest patients they have, patients that have psychosocial challenges that make it hard for them to comply with their care plan, or have even fundamental problems with transportation or even housing. One of the things we find is a lot of caregiver issues. A lot of the seniors that we work with have got a spouse that's trying to care for them, and just the ability to manage the chronic disease with meds, fall risk, other kinds of challenges like that can be really tough for the physician to manage from the office. Our program actually goes into the home, does a full assessment in the home of that environment, and then we report out to the primary care physician on our findings and with our recommendations for an action plan. There are sort of two operating rules that we're trying to follow to make our program successful and really integrate with the physician's practice. One is that we come in with a frame of reference of we work for the physician. It's her patient, it's her care plan that we're implementing. So everything we do is working for that primary care physician. The other thing we try to do to set ourselves apart is we try to leave as small and light a footprint as possible in the practice. We do as much of the work as we can from the home or by phone. We work real hard to understand that that's a busy place, that practice, and we don't want to interfere any more than we have to. We continue to see it growing. We have grown from a staff of only 10 to over 30 now. We expect to end next year with over 40 or 50 staff members and be in every single practice, every single primary care practice in United Physicians.